Transcranial direct current stimulation and schizophrenia. The overall main focus of this multimedia presentation is to investigate how transcranial direct current stimulation influences the physiological mechanisms of schizophrenia. Schizophrenia is a psychological disorder which can cause an individual to have an altered experience of reality. Intensity of these symptoms vary amongst individuals, but there are three main categories of symptoms. There's positive symptoms, negative symptoms, and cognitive symptoms. Throughout the years, several researchers have used neuroimaging techniques to investigate which areas of the brain are affected in a schizophrenic individual by comparing scans to normal functioning brains. Most research has found evidence of frontal lobe dysfunction, most notably the dorsolateral, ventrolateral, and anterior cingulate. The dorsolateral prefrontal cortex, also referred to as DLPFC, has been found to be one of the most impacted areas of the brain with schizophrenic individuals. Studies show schizophrenic patients' DLPFC tissue show support for preattributions in excitatory cells and inhibitory cells. Other areas of the brain have shown to be impacted in schizophrenic patients, such as the medial temporal cortex, the basal ganglia, and the thalamus. Defining physiological features of schizophrenia is grey matter loss, which includes reductions in spine density in these parts of the dorsolateral prefrontal cortex. Neuroimaging studies have found left temporal hyperactivity during auditory hallucinations, which 50 to 70% of individuals with schizophrenia experience. Even during treatment with antipsychotic medication, 30% of individuals who receive these still experience hallucinations. It is this issue of refractory symptoms that is obviously needed for an alternative form of treatment to help manage auditory hallucinations and other symptoms. One potential approach is transcranial direct current stimulation, which has found to be clinically effective in reducing persistent auditory or visual hallucinations among schizophrenics. What exactly is TDCS? TDCS is a contemporary portable non-invasive neuromodulated technique that delivers a low electrical current to the scalp. It involves by applying an anode, which is a positive electrode, and a cathode, which is a negative electrode, to brain areas which causes depolarization or hyperpolarization of neurons. The current delivered by TDCS are usually weak, so just normally about between 1 and 2 milliamps during 20 or 30 minutes. So they aren't strong enough to cause an action potential inside neurons. Back to the main focus of this presentation, how does TDCS influence the physiological mechanisms of schizophrenia? As a large percentage of antipsychotics have found to favor reduction of auditory hallucinations in schizophrenic patients, multiple case studies have found TDCS to be effective in controlling such symptoms after multiple treatments. Most studies focused on using anodes and cathodes over the left dorsolateral prefrontal and temporal cortex, as these are the main areas of the brain which are affected abnormally in schizophrenic patients. One study reveals after 10 active TDCS sessions over 5 days, they observed a 31% reduction in hallucination severity. The effect of TDCS on auditory verbal hallucinations seemed to be maintained in this for at least 3 months. Results suggest that increases in excitability at the left dorsolateral prefrontal cortex may contribute to the transient diminishing of negative symptoms. Results endorse the use of TDCS for reduction of negative symptoms in schizophrenia. Placing TDCS control of schizophrenic symptoms in positive light, there are still some limitations. Case studies have only represented a limited number of the population due to sample size, and research has been put forward contradicting evidence for the bulk literature. In 2015, an article was published where researchers evaluated 5 days of daily TDCS targeting the left frontal and temporal areas to reduce auditory hallucinations with patients with schizophrenia. Research found their study to contrast with previous findings and that their treatment group had no significant changes. These findings also suggested the issue of placebo effects. This literature suggests the need for future investigation into non-invasive brain stimulation for the future. TDCS has found to be effective treatment for patients with schizophrenia by manipulating neurons, especially in the frontal area of the brain and DPLFC. This has been found to be a successful alternative to antipsychotic drugs, even alleviating auditory hallucinations in patients whom have not found antipsychotics to be successful. There are existing gaps in literature due to case studies of small sample size. Findings need to be replicated in the future. With progression of future research, this non-invasive tool could be the future of treating psychological disorders.